to see if she'll join.
Okay.
Good morning, everyone. Today is June 18th. My name is Jimna Miller. I'm one of the co-chairs for the Autism Advisory Council, and I wanted to welcome everyone. We have a packed agenda today, which was posted and found on our council website. Thank you to Tara for posting that. I think we'll start first on the agenda. Our first item will just be opening up. We always put public comment first, Tara, but I feel like we also have minutes that need to be.
Yeah. So I didn't get any formal requests for public comment, but Melissa was not able to join the last meeting, but she did watch it and wanted to make a comment. That's why I was asking if she was on yet. I mean, she's not part of the public, she's a member, but I just thought I would allow her that opportunity. There you are, Melissa.
Here I
Hi.
am. Sorry.
No worries.
Sorry,
I
I
just
just
wanted
got out of
to.
an appointment. Thank you. So I was out of the country for the last meeting, so I apologize I didn't attend. I wanted to just add to the discussion that around hiring, because I know there is a shortage of life skills coaches and mentors and things, and I also had thought that it would be a great idea to tap into the community college and state college system. I don't know how that would get organized, but I wanted to just say that I would love to be a part of that. I'd be happy to be involved in the recruiting of that and things like that. And the other suggestion that I was thinking about was, I don't know if it would ever help for retention of employees to have like almost, I would say maybe like twice a month or maybe even once a month of like a meeting where the employees could come and check in. Because I know Felicia does the training and I know that's very thorough, and I know that that trains them. But as far as like ongoing support for them, like a place for them to maybe be able to problem solve, or um, you know, a place where they could ask questions, a place where they could bring up scenarios and say, "Oh, I'm not really sure exactly how to handle this or that." That was just another idea that I had. Again, that I would be happy to be a part of. Of offering something like that, some more like ongoing support for employees who are working with individuals in like the life skills and mentoring capacity. So that was just something I wanted to add to the discussion from last time.
Great. Thank you so much. And I will say, Lynn, we have a meeting next week on Wednesday afternoon for the subcommittee on the workforce and, in education and training subcommittee. So if you can't attend that, I'll make sure to, relay that to the subcommittee as well, as, your willingness to be a resource for that. So thank you. I
I
appreciate
thought
that.
that was a good segue, Tara. I thought that there was a lot of synergy with that comment. So great.
Okay, thanks.
Yep. Okay, thank you. So yeah, now we can, if anyone would want to make a motion to approve the March meeting minutes.
So moved.
Thank you, Lynn. A second.
Second.
Thank you, Christine. Okay. And then we have the Jennifer Crom. I believe I saw you join. Do you want to go first, or Susan? Either one of you.
I'm here. I'm happy
Okay.
to go first and kick us off.
Thank
Let me share my
you.
screen.
Oh, I may have to give you permission.
You
One
do, yeah.
second. Oh, I just have to go full. Hold on one second. Okay, you should be able to now.
Okay. Are you able to see my screen?
Not yet.
Yeah, hang on. I had an
Okay.
update to this, so the
Oh,
layout
wait.
is all different for me
It's
now.
coming. It's coming up. Yep. Now we can see
Okay, there it is. Okay, and now I can't see you guys, so
it. I'll
speak
let you
out if you
know
have a
if there's
question.
any questions.
I
I'll
love
holler.
technology updates. All right, so here is our review for May 2025 data for the Medicaid funded services that Carillon Behavioral Health oversees. So as of June 2nd, when we ran our data this month, you see a continued increase in the treatment plan and program book development. That's that light blue line that's at the highest level with the 8,300 individuals. Keep in mind that this is a rolling cumulative number for the past 3 years, but we show the past 3 years on here on a rolling basis, but this is the total number of individuals. And then we also have the next highest is the behavior assessment number, and that is typically authorized at the same time as the treatment plan and program book development. So those are typically our two highest. We have about 5,500 cumulative diagnostic evaluation authorizations. And then the overlapping green and black line, I know the black line is hard to see there. Those are the treatment services and direct observation and direction, which are authorized at the same time, with the direct observation being 10% of the time of the delivery of the direct treatment services. The lowest number remains at the group treatment services, that aqua color on the bottom with the 268 individuals, and that still remains one of our lowest utilized services. Here we see the current open authorizations. So we currently have 526 individuals authorized for diagnostic evaluation. We currently have 5,234 individuals who are authorized to be receiving direct services, and then 86 for the group treatment services. Here we look at our monthly admissions based on age of admission, and admission here is defined as the first authorization for an ASD service. Our 3-year-olds continue to make up the largest number here, with 1,825 3-year-olds accessing any one of the authorized services that we provide. Our demographics are a pretty stagnant number for us. The unknown bucket, as I always remind people, is defined as individuals who do not identify their race or ethnicity at the time of Medicaid application. That continues to be our highest percentage of individuals making up our authorized group of youth for autism services. So the unknown group is almost 35%, followed by Hispanic youth, who are almost 27%. White youth, who are 19.6%, Black youth, who are almost 13%, and then Asian at 2.3%. The largest group of our individuals accessing services are not involved with DCF. You'll see that we have about 96.5% of youth who are not involved with DCF. We then have about 4% of our individuals who are either DCF committed or going through the CPS investigations process. Our other pretty stagnant numbers here are authorizations based on DCF region of the state. Region 4 and 5 continue to be the highest number of area of access services. We have the highest number of providers in that area of the state, as well as pretty dense population. So that's like Region 4, Manchester, New Britain, Hartford, that whole area there, kind of in the center of the state. Region 3, that Rhode Island border, continues to be our lowest number of authorized units, youth. It's a less densely populated area. We also only have 3 providers who actually go out to that area of the state. So that is 908 individuals currently in that area. We'll now look at our care coordinator and peer support activities. So here, I can't remember if last month we had reorganized this the last time I presented to this group. or if I just let you know that a change was coming. We've reorganized a little bit of how we're supporting referrals and youth coming into care coordination with us, just because the numbers were so high. And we don't maintain a wait list at Carillon. Every individual who comes to us looking for care coordination or peer support is assigned somebody. So we've moved to a little bit of a different organization in that we have a triage care coordinator who receives all referrals coming in. She speaks directly with the referral source and the parent or guardian to go through information about the youth and what they're specifically looking for, and determines the level of support that the family will need in order to access services and supports. If she determines that they don't, if she determines that they just need help accessing those referrals to an ABA provider, they would get sent over to the referral care coordinator. So that's our 82% of individuals. That's that bright blue color. So most of our families, that's our old tier 2 family when we were using tiering systems. Most of our families are able to, that's all they're looking for. They're looking for referral sources. Our referral care coordinator reaches back out to the family on a monthly basis. She maintains a list of all of the individuals. I think we have a little over 500 individuals who are waiting for services right now. And she's calling directly to providers on a regular basis to find out who's accepting referrals, what demographic of individuals they're looking to serve, and what their wait times are. If a family requires a little bit more support than just that, and they have other needs, whether it's housing or food insecurity, or they might have DCF or DDS involvement, we then also assign them to a regional care coordinator. So they would stay on that list with Sarah, our referral care coordinator, to be reaching out. And then they would also be assigned a regional care coordinator. So that's our old structure of having the regional care coordinator who knows the services and supports in that area of the state. They have a more frequent contact with the family and will help them fill out the DDS eligibility forms or access any of the other things that are coming through recommendations through DCF, if that's the case. For our highest level of support for individuals, we have about 2% of individuals. Those are typically individuals who are at hospital for special care or other inpatient levels of care, or have significant needs. So sometimes that might be a parent who has their own mental health or cognitive challenges and needs that extra support. So for the wraparound care coordination team, that's 2% of our individuals. They actually get a team of a care coordinator and a peer specialist and meet on a weekly or more frequent basis based on what the family need is. So while that's a teeny tiny 2%, we do have a ton of individuals who do require, when they require that level of support, it's a ton of support and a lot of our time that we're dedicating to them. So that's our new setup. So I know we have about 500 individuals that our referral care coordinator is managing and getting out to providers to connect to. We also then have other groupings of individuals that our care coordinators are preparing in order to access services. So gathering documentation, that number has decreased significantly since switching to this new format and how we're supporting families, because we do that right at the right onset of our very first call with families. So we're able to access those, obtain those documents that we need in order to connect them to services much more quickly.
That's great. That's a great call out. Thank you, Jennifer.
Yeah, you're welcome. I did just want to also give a plug. We are having an autism provider forum for our Medicaid enrolled providers. This will be our second forum for this topic on June 24th regarding mitigating risk as an ABA provider. And that will be on June 24th from 2 to 4. The registration is in my signature. So Tara, when you send out these slides, if you can also just include that registration, that would be excellent. So that's available to all of our Medicaid enrolled providers. You do have to register in order to access the invitation to it. Okay. Thank you, everybody. Any questions?
None in the chat.
Okay, thank you.
Thank you, Jennifer. Susan? I think you're up next.
Okay. Yep. I think I need permission to share my screen
Oh.
too.
Okay. You should have it.
Okay.
Let me know if you can't.
Yep.
Okay.
You see, you're good.
It's coming up. Yep, there it is.
Okay. All right. So here's our report for June from the Autism Waiver Services. Whoops. Currently on the wait list, there are 2,377 people, which is up from last quarter. So in March, there were 2,300. Now there's 77 more people. So 353 cases have been assigned to our 9 case managers. Each case manager has almost 40 cases. 257 of those 353 cases are active on the waiver, and there are 96 people waiting or in the process of onboarding, working with case managers to get onboarded onto the waiver. 87 of the 440 slots that we have now are not yet assigned to a case manager, and we still are down 2 case managers, so that will help us out once we get those in place. 12 case managers, I'm sorry, 12 cases have been assigned to case managers. So this is from the last quarter. This is our increases. So we have 12 cases that have been assigned to case managers, an increased 3 cases that are active on the waiver, an additional 9 people that are in the process of onboarding, and an additional 12 people who have come off the wait list. Even though we can't catch up, more people come on, but we're trying to get people off. So our improvement plan, we talked about last meeting, but we're still working on the new case manager interview list with our HR, and we hope to schedule interviews in July. We continue to work on our process to streamline onboarding and continue to find more ways to get individuals active faster. We have weekly meetings to help get this streamlining process updated. That will help eliminate the long wait time between the stages of onboarding. We also continue to work on ideas for some possible amendments that could be made to the service descriptions. I know a lot of providers have difficulty, so this could attract more providers without waiting for rate increases. That's it.
So I have a quick question. So if you fill those 2 case manager spots, does that put you at capacity for case management? And looks like you're able to hire now, because I know there was a freeze for a little while. So does that put you at capacity with the full waivers, like all the waiver slots? Because 40 seems a little high.
Yeah. Yeah, I think
yeah.
so.
Yeah.
Oh.
So Tara, the two refills, the 2 vacancies are to kind of just level set up to the current people that we're serving and a few more. We have a supervisor carrying a caseload. We have some staff with higher caseloads than we would really want. We have, 40 is like the top number. It's a lot for the staff to maintain that many cases. It's not ideal. However, we're not living in a very ideal hiring practice. So where we say we have we have permission for the 2 vacancies, we don't have permission for the 5 new spots that are supposed to help us onboard all the additional waiver, all the other slots that the legislative 2 years ago, 3 years ago gave us. So it's kind of like we're catching up but falling behind all at the same time. So we've had these 2 vacancies for a very long time. They were start-stopped. As you know, there's a lot of fiscal things going on in the state. We do have permission to hire, but we're kind of now stuck in this state HR hiring quagmire right now. So we're getting through that. when those two onboard, there'll be a ramp up period, there'll be a training period. We'll be, they're not going to get handed 40 cases. That's not really feasible for individuals. So once that is ramped up, at the same time, we're going to be requesting the other 5 positions, but there's no guarantee that we're getting those. So we'll be able to serve a few more initially. We'll right size the caseloads of all the case managers, and then we'll continue to onboard as we can as those build capacity to carry a large caseload. Right now, we have some veteran case managers that are making it work. We don't know from this pool of individuals how fast they're going to be able to take on 40.
Okay. Is there anything that you need from the council in regards to advocacy for those additional slots for case management?
Yeah, so I think you guys have done a tremendous job. Like, I've actually called out this group to other advocacy groups that I said, like, they got it done. You did your work. Right now, it's a matter of appropriations and funding and us figuring out how to balance it against the entire DSS workforce where everyone needs positions, right? So the state fiscal year hasn't ended yet. Right now, we have the 2 positions that were approved within this fiscal year. We're going to reevaluate next fiscal year, which is only July. So it's only in a month. But yeah, it's part of a bigger department-wide, resource constraint that we have. So we'll let you know if we need any calls or emails or support. But right now, you did what you had to do. You amazingly got us slots, you got us staff. It's just now funding that kind of in the current state of the state. So we're working on it.
Okay. And then I know that I'm sure a lot of people heard, that there was legislation passed for increased wages for nonprofits and also Medicaid rates. Will that be impacting the autism waiver at all?
So sorry, Tara, right now I can't really speak to that.
Okay. From
a department perspective, I can't share that right now.
Okay. So when we have those details on what the impact to, providers in the autism waiver specifically, can we get an update on that from you, please? Okay, thank you. I appreciate that.
Hey, this is Yana. I just wanted to throw in, I always check in with my case manager to see what's going on in the program, see what they need. One of the things she's mentioned to me that they could use more of is RAP certificates, rental assistance, housing certificates for individuals. Because I was one of the lucky ones, I was able to get one, and I know how life-changing it can be. So if that's something that can be done through this council could push for to get more of these housing certificates for our individuals to get more people out of mom and dad's house and into independent living in the community, that would be great, because God knows I wouldn't be able to afford an apartment on my salary at market rate. And I know that's the case for a lot of other people. So if we could
I think we have a subcommittee that's going to be working on housing, and that's one of the things that I would like to bring up. I know that if you've been following any of the federal legislation, there's a tremendous cut to Section 8 and housing. So I know that the Department of Housing, is struggling to find those, additional funding for those things, as there's been cuts at the federal.
Oh yes, I've been following it. I am concerned about what the future of the waiver is going to be with all of these Medicaid cuts, because we are a Medicaid funded program. And that leads me to my next question. Do we have any kind of a contingency? Because what we don't want to do is rip people off services.
Yeah, there's a lot of predictive analysis going on at the state level. And I can assure you that there is a lot of conversation, but unfortunately, like, nothing's been legislatively passed yet. So there's, a proposal in the Senate right now. So we are, and I know the entire DSS Medicaid unit is working diligently to, look at that and kind of plan and predict, what the impact to Connecticut is going to be. But right now it's just a wait and see because we don't have any concrete information. So as we get more information, we'll definitely communicate it to this group.
All right, that's just what I wanted to know because a lot of people are concerned about what's going
Yeah.
to happen. And the thing we don't want to happen is to rip services from underneath people's feet and then have families and individuals flailing.
I think that there's a lot of sympathy to that and a lot of concern, not only across Connecticut, but nationally. So,
And I know that I'm not a top priority. I can live on my own. I can get by if I needed to. But there are other people who are more the profoundly autistic community who need more supports, who rely on Medicaid. So I hope it's just now this is me advocating for them because they need it more than I do. I could get by, but we have other people who are more profoundly affected, other families who really need these supports.
I appreciate that, Yana, and I know there's a lot of people out there who are advocating for that too. So I appreciate that.
And
Thank
by
you.
the way, today is Autistic Pride Day, so happy Autistic Pride Day, everyone.
Thank you.
Thank you.
This is Lois. I wonder, given the level of concern here in the state about what's going to be happening, whether it would be possible to have a speaker in, someone from the state that might be able to give us some information about, what people might be doing.
So look, I think that could happen in the future. Right now, nobody knows. Nothing's been
Yeah,
passed.
I
I would, if anybody is curious, you know, there's other public meetings that have happened in the last couple weeks, like MAPOC and BPOC, where, I know Commissioner Barton Reeves was on discussing some of the federal things that they have heard. Those are all public meetings. You can access that through the Connecticut website if you were interested in watching those, but nobody's going to be able to tell us anything right now. Not until we have solid information. I'm open to it once we have it, but
yeah, no, I understand.
yeah.
Any other questions? Thank you very much for your presentation.
Yep. And just, just as a little plug for DSS, just with everything that's going on, DSS has launched a social media campaign entitled Medicaid Matters. So if you guys do want to push the details through that, that is primary source information about all the great work that comes out of Medicaid. So if you want to look at the Department of Social Services Facebook page and share that stuff widely, I know this group reaches a lot of networks and a lot of people. But yeah, it is uncertain times. We're not taking any actions right now, Lois. We're just kind of business as usual, but being mindful that we might have to pivot at any point. But the Medicaid Matters campaign is really critical for us to kind of get the message out about all aspects of Medicaid. So it's interesting. I repost and share it regularly myself on my private account. So I would just recommend you guys looking at that too. And that's it for DSS.
Marsha, thank you for your comment. I was just reading it. Okay, let's go see what we're going to cover next on our agenda here.
Oh, gymnast, while you're reading, sorry, I was thinking, I was hoping that maybe the council could put up a statement in response to what RFK Jr. said, because a lot of our families and individuals, including myself, are really struggling with his words. He said, people on the spectrum ruin families. We don't pay taxes. We don't work. We can't work. There was a big article about the families responding in the newspaper the other day, and I thought maybe we could respond and say something, because those words were really damaging. A lot of people were struggling.
Yeah.
Uh,
Yeah, I'd have to defer to, because we are a state appointed council, I'd have to defer to how the state would allow us to do that. Certainly, as a parent of a child of autism, first, and then a council member, I definitely have feelings about that, and I've been vocal about that, Yana. I know, Tara and I have met, and, because of all the work that the council has been doing in light of recent events, legislatively, I know that we've put our heads together and looking to post something on our site perhaps about the good work that we have been doing. So just for the broader, transparency just to the people that do come to our website. I think there's a lot of emotions, and people that have been touched by a lot of the rhetoric that's been going around. So it's really hard to really put a pinpoint and have the council take an external formal stance on that, I would
I
say.
was just wondering, and irony of all ironies, this is the man whose aunt Eunice founded Special Olympics. I'm sure she's rolling in her grave.
Right.
Mm.
I th- I'm sorry, was there someone else? Lois, did you want to say something? Oh, okay. I think we were after DSS. Tara, did you want to move to council business next on the agenda, or should we?
Yep.
Okay. All right. Where should we get started? I'm trying to get.
We have a lot to talk about.
We do.
Why don't you start with, council partnerships, if there's an interest, and you can update on rare disease.
Yeah, so I'm looking at our agenda, which is bullet point 4. I wanted to provide an update on a meeting that I was invited to by the Rare Disease Advisory Council. This is a new council within the state, and they are made up and comprised of parents of families that have been affected by rare disease, as well as local scientists, research firms, academics, also within the state. And they had invited me to give an update to their council, because so many individuals with autism also have rare diseases, number one, and secondly, and particularly in my case, my son does have a rare disease that caused his autism. So I don't know if I had shared that with the council, but just as a personal note, I had my family had participated in the Simons Foundation's Autism Spark research at Yale. And so we had many months went by, and then we did find that my son does have a rare disease called Smith-Kingsmore syndrome, and that has been linked to autism as well as epilepsy and some other things. So I personally have attended the Smith-Kingsmore conference in Chicago last year. So that's been really eye-opening to me. And so when we got the invitation to attend the Rare Disease Advisory Council, or ARDAC, I have particular interest in it. What I shared was largely what Kim Meerman had put together, along with some other members of the council, regarding our legislative priorities. Because this council is so new within the state, they're really just trying to learn about how other advisory councils can operate in the state. how we get some momentum and just, learnings, what they could also learn from other advisory councils. They obviously have a legislative agenda of their own. And so they were really interested in ways that we could, partner. They are going out to other advisory councils, as I mentioned. And so I provided a 10-minute update on some of our legislative priorities. Obviously, this is so much was happening in the last 2 months up at the Capitol. So it was really kind of hot off the press in terms of where we were. But I think that it was worth sharing with them. And I truly believe that a rising tide raises all ships. And if it's helpful for our community and the people that we serve, from the autistic population in Connecticut, that it really made sense for us to connect with that group. So I wanted to share that update. It was recorded, and they do have a website as well. So I can make sure that everyone has a link to that if they wanted to learn more and just learn more about that council. So that was one update that I did want to provide. I don't know if anyone has any questions for me right now. But yeah, so that was my update there.
I think that one of the questions that we had discussed too is that if there's interest in the council, for having learning opportunities like that presented, in our meetings to see if there's ways that we could collaborate in the future. So just we can get some member feedback if.
Yeah. Kara, it's Lynn, I think, and Jim, I think it makes a lot of sense. I think whenever you can intersect, and I think our goal is to, we can't do it all alone. So wherever we have it, nor can they. So I think whenever we have an opportunity to collaborate and open up some, like, I have never heard of that syndrome, Gemina. So I wrote it down, and I think if I haven't, I'm sure many other people haven't as well. So I think it's helpful. Just by way of information, I see Megan Gallagher has joined from Hospital for Special Care, and this is my last official meeting because of my retirement and my official end to my role at the hospital. But I mentioned that one because Megan, I hope we will be pursuing her to take my role as a provider representative on the council, but also because Megan has familiarity with a lot of what other things are happening at the hospital. And the reason I bring that up is because we actually, because of our programs related to neuromuscular disease and the many rare diseases that fall under neuromuscular, we actually have one of our physicians, Dr. Kevin Felice, is on that council. So I think there's some ways for information to kind of flow between organizations that have similar experience. And he's been there since the council was founded. So
that's wonderful. Thank you. I didn't know that. So I appreciate you sharing that.
Sure.
And welcome, Megan. It's nice to meet you. One other update I had was I was attending an event in the community here in my hometown. And we did have, there was a resource fair, if you will, with a table. And I was approached by this agency. It was DCF. DCF is also encountering many individuals within their, entering their system. And of course, we know the numbers that, a number of them have autism. And so they are very informally, very at the very beginning stages of putting together just a work group, just parents, and really anyone that wanted to join, just to understand what the needs are for the autistic population. DCF is getting inundated and they just don't know what they don't know. And so that was also another agency that I had been approached by. And so I mentioned these two things to Tara, and it's really becoming evident that, number one, ASDAC is getting, recognized for the hard work that we have been doing. And number two, that we really can be a resource to these other agencies and that we have an opportunity. And again, that was the second partnership, if you will, that I wanted to mention to this group, and the genuine need that's there.
So I'm not hearing any objection to this, but if we look into future meetings and have a time on the agenda to invite some of these other councils, or, I did already reach out to DCF to see if they would like to take a few minutes to, publicly inform the group about their initiative, that they could do that. They couldn't attend this meeting, but I think they're going to try and attend our next one. So if there is any objection, you don't want to say it publicly here, just shoot Gemini or I an email, and we can address that with the council. So
Thank you.
and next was March meeting, if we wanted to try to target an in-person meeting. If you wanted to talk about that.
So we're 6 months out. Well, actually more than that. We're 9 months out for March. We are, looking to wrap up the time here in 2025. We only have a few more meetings left, but as we look forward to 2026, I think that Tara and I were talking, I think that it's been a long time since we've all been together in person. We have a lot of new members that have been appointed, and it would be great to get us all together. We have Lynn who's told us she's retiring. So it'd be nice for all of us to get together if we're able to. If we do decide that, we do need to get with Representative Exum to reserve the space. So the sooner we could, take a pulse check here with this group to see if that would be something that everyone would be open to. We'd really try to get that on the books. Of course, we would also have it available virtually. And the public would of course be invited to attend as well, which I think is important and vital to the work that we're doing. So that was the next agenda item that we wanted to cover.
And it's
Tara, did you have
important
anything else?
it's important to note too that would be it's a short session this year, but that would be during session. So it would be an opportunity for us to engage with legislators as well. So just wanted to add that. So
Yeah.
is there interest and availability for that Wednesday meeting in March of 26?
I think it's an excellent idea. This is Lois. I think it's time. And I think it's important for us to meet the new people that have been brought on and for them to meet us. So I think I certainly would be in favor of that. I think it's a long way off. I would probably be doing it before that, but I think that's great.
Well, that's why I have to get it on the books, which is why I wanted to make sure that, if there was, an appetite for it, then it's, a time period that people could hold. So
I think it's just critical, even because of the legislative session.
Yes.
It's, when it's an opportunity to have that informal contact. And I think even at Autism Day, while we did have participation, I think, it's changed quite a lot over the years. And I think I felt like there was a little bit less participation than in the past. And it could just be coincidental in the time of the session, but I think it maybe, puts you there in advance of April's Autism Day and really makes it more about the council and not just because this is really helping to drive the agenda of the council. So I think it's great. Makes a lot of sense.
Yeah, and I would even thank you, Lynn, because I was thinking the same thing, having been at the Autism Day at the Capitol and having a chance to meet some legislators. I would even, in preparation for that, I would even begin to work on maybe, like a toolkit so that members of the council that, are serving and not as an agency, but as other, members in the community and academics and universities and just parents, a toolkit for how to line up, line up meetings, informal conversations with your hometown legislator and find out what committees they're sitting on, how, we are also advancing, the different legislative priorities that we have. So Lois, yes, I'd love us to get together sooner, but I really think the timing of being, in person at the Capitol would really carry a lot of weight and a tremendous amount of opportunity for so many of us.
No,
Yana,
yeah,
okay.
I'm sorry. I agree. I think, ASRC had started Autism Awareness Day at the Capitol many years ago. We ran it for many years. And that was indeed one of the things that we did. We reached out to our parents and helped to organize, a lot of contact prior to that day, having people reach out to their legislators to get them there, for one thing. There's just a lot you can do. It might be an interesting idea. I don't know how you feel about this, but having the council sort of be involved with Autism Awareness Day and the involved with doing the day. I would think that would be, well, I don't know. How do you feel about that?
I think it's fine. I can reach out to Denise Drummond from,
Yeah.
and I don't think that they would deny us if we were willing to help out. I would just, want commitment from members of the group to participate and, do that work.
Yeah, I think, but I think I think we could be helpful in getting people there.
Yeah, we definitely have a role to play, and with this very energetic council, and some new blood here on our membership, that I think that we definitely have a role to play with the Capitol, and that we can certainly, again, it'll take help. But I would agree with you, Lois. I thought I saw Yana's hand up. Maybe it was you, Lynn. Go ahead.
Yeah. So one thing I think may be helpful if we move towards that March meeting, which, I won't be involved in, but just offer a perspective, is not everybody is necessarily comfortable talking with legislators. And one of the things, a group that I was involved in nationally, we went to DC every year as a board, and we needed some, initially folks needed help on what do you say, like how do you maximize the time, how do you speak with one voice. Obviously each individual represents an organization or their own perspective as a parent, for example, but I think some prep work in advance of that could be really helpful in being able to have the greatest impact and have folks walk away from that experience really feeling like, compelled to do something because they have a good understanding. I mean, I think there's been a lot of momentum that has built over many years on the part of the council, and I think autism has grown to be one of the hot topics almost in every session. For lots of reasons, but I think that it would be really helpful. And I think you may get more participation because nobody wants to be intimidated and have that conversation. They may be very comfortable with the work they do every day, but talking to a legislator can be intimidating, and they want to hear from us, but I think it's helpful for them. They have so much thrown at them. If it can be sort of coordinated and folks can have some tips in how to communicate effectively, just a suggestion, and happy to share some of the kind of approaches that were used with this other group.
Absolutely, and that's
Go ahead. Sorry.
No, I was gonna say, like,
yeah, sorry. We're just
go ahead.
chit-chatty today.
Go ahead.
I did that once. We did like we had to do an elevator speech, like, right, to like be able to advocate for something. So I do think that that's beneficial.
And that's, Lynn, I was gonna say that's exactly the kind of toolkit, that I would have in mind, right? And just to have people prepared. So thank you for sharing that experience. And yeah, let's definitely get together on that for some pointers. I'd love to learn more. Thank you.
Oh, gymnasts. By the way, the Autism Self Advocacy Network, they have a whole guide about how to work with your legislator. And I really like their guide. It's easy read. There's a lot of pictures. It's not a lot of jargon. So it's not just for self advocates. It could be for families too. They have a really good guide about how to make a phone call. They have a how to write a letter. So I can link that up if you want.
Yeah, please. And we'll take all the help.
I too know how to do the elevator speech. I did partners in policy making, and one of the things they taught us in that advocacy class is how to do an elevator speech in 3 minutes. And if any of you are interested in partners, it's a wonderful program.
That's exactly what I was referring to, Yana.
Oh, you were in partners too?
I was part of the you said, so I was on the other side of it. I didn't participate.
But you know, yeah, we had Molly sitting there with a timer.
Yep. Yep.
Molly and Gretchen with their timer.
Exactly. Okay, so it sounds like people would be willing. I'm not hearing any objection to the in-person meeting, so I will move forward with contacting Rep Exum to see if we can reserve some space for March during our regular meeting cadence, which would be that Wednesday. I'm sorry, I didn't pull up the exact date, but I will. Okay, next we have subcommittee updates, and then just looking at next year. You know, Len, you stole one of my agenda items, which was to talk about your retirement, but and next steps on that. But so as Lynn is chairing currently the education and training subcommittee, so we meet again next week. Is there anyone who would be willing to step up and help chair that subcommittee so we can continue that work? Or is there, you know, interest in continuing it? What do people, what would they like to do? We'll start with that one. And Len, as a non-member, you can still participate.
Can I give a little bit but I was going to say, can I give a little bit of update on the committee? Because I think we did meet last month, and the month prior when we met, I felt like a little bit we were circling the drain, because trying to get we've had great participation actually, but really just trying to take a step forward. And again, partnering and collaborating seems to be the best way to be able to move forward. So after the last meeting, I agreed to work on coming up with some questions that we might pose to different state partners to be able to gather information about the work that they were doing. And I shared those questions with Tara. Those were sent out to a number of agencies. And just this morning, because we did get some responses back, and actually I see that we got one from Anne, even since I put together the summary. But I did send Tara a summary of all of the questions that were asked, and then all of the different agencies' feedback, so we can get that out to the subcommittee before next week's meeting. And hopefully we can, I honestly have not, some of it came in yesterday, so I've not had a chance to really call through it, but I did at least summarize it into one document. So I think we have a starting point. One of the things we talked about is coming together and doing a forum and actually committing a couple of hours to go through and to see where can we intersect and decide to move forward. So I think I'm feeling like we got a little bit of momentum from the work that was done. We did pause and not meet last month because I felt like it was going to be not a productive meeting because we had not gotten the information. So after today's meeting, we can add Anne's information to the list and then send that out to the committee. And I think we can make a decision about whether or not having a forum would be effective, and then begin to plan for that. So just an update.
So we can discuss this a little further in that committee meeting to see if, you know, there's interest from the group of members who have been participating. And also, if you know other people who, you know, are passionate about this work, we do not, you know, as part of our council, we do not limit subcommittee work to members only. So happy to include other parents or advocates, anyone who would like to, participate in that. If you have, know someone who's interested, please feel free to send their email or contact information to me, and I can forward the invite to them. So. We did have another, Kim Meerman could not participate today in the meeting, but suggested a legislative subcommittee. During session, it does get quite busy. There's a lot going on. It's hard to pull the whole council together for, conversations around, proposed bills that may impact autism and or services. So she was willing to chair that subcommittee. So if there's other interest in participating in that, please let me know and we can get that set up for, in advance to the next session.
I think that's a really good idea, especially because we know there's just not there were sessions that ran out of time, just to even get, some discussions on one of those bills. So we really need to keep the momentum going on legislative priorities. And so even between sessions, to have a subcommittee, and it's open to the public, for parents that don't have interest in here or that their legislator in their town sits on a committee that's, putting a bill forward or reviewing it, then, I think that's a really great opportunity. And I'm really pleased that Kim brought it up and that she's offering to chair that.
Yeah, because there was a few letters that we wrote on behalf of the council last year. So that would just allow us to, respond to things that are coming up. And thank you, Christine. And, get those types of things out faster, so to speak. If we don't have to use the whole council every time, if we can just use that subcommittee to get that information out, as long as it's obviously in line with the council's priorities.
Great.
Okay, so you can let me know about that. And then I know Stephen couldn't join today, but Lois, I don't know if you want to talk about, is she still on? I know she had to drop.
Yeah.
If she's not on, I know that the housing subcommittee had a great presentation on a model in Virginia. I don't know if everyone got to see that. Dr. Schlegel, I see that you're here. So, and thank you for making that connection. But I think that there's a lot of discussion around housing right now and affordable housing in Connecticut. So if this is still a conversation in a subcommittee that we would like to continue, I definitely think it's relevant. So if there's interest in continuing that, please let me know and I'll be able to set up a meeting cadence for that subcommittee as well.
Yeah, Tara, I'm a part of that committee, and I was going to ask if there were meetings set up to meet for housing, because I'm happy to be.
There hasn't been.
Okay.
They were, kind of waiting to see kind of some of these other things if they were able to move forward. So but it's definitely something that we need to pick back up and have more of a consistent meeting cadence so that we can actually get, see some progress.
Okay. Yeah, I'm happy to be. I'm
Okay.
happy.
I would love to be a part of that too.
Okay.
It's something that we really need.
Okay. And if anyone else is interested, just let me know either in the chat or send me an email. And is there any suggestions for other subcommittees that anyone would like to propose? Okay. Hearing none, then I will give a quick update on appointments. I'm still waiting on an official appointment from Senator Looney for Lois. I will pick up bugging him on that now that session's over. I know that, as Lynn said, we did notify the governor of her retirement and sent Megan's information for consideration. And so we will have an open position there. And then we also still have one open position for an adult with autism. So if there's anyone you know of who's interested, you can send contact information, and like they usually want to see that one's for the speaker. So they would want to see like the person's bio, a little information on why they're interested in serving on the council, and or like a resume or something like that. It's always nice to send a picture or two, so I can put that little packet together and send it to the speaker, and just let him know that we have a person who would like to be considered for that nomination. I don't personally nominate, but I'm happy to pass that information along. The council can't nominate, it's an appointed position. So all I can do is pass it on to either the governor or the speaker or whoever the nominating person is.
Tara, do you have any like a little write-up or anything that we could give to somebody who might be interested?
I don't, but with permission, I can like I did one for Carrie when I had to submit hers. So with permission, I can remind her what that looked like, and then I can share that just so you could see kind of what we did to try to get the appointments filled.
Yeah, I guess I'm thinking more so that for the individual to know what they would be committing to or what, because I can actually think.
Oh, got you.
Sorry, yeah, not for that. Yeah, because and Christine's
My apologies.
Text putting in the chat too. I think it's similar reason. So I can think of an individual perhaps who might be interested, but I also want to have an official way to describe it to them and tell them what they'd be doing, why they'd be helpful. And not to sell it, but to explain it. So is there something like that, like a little blurb or a little information flyer or anything?
You don't have a blurb. I mean, our bylaws are not long. That would be maybe a good place to start to just see like what the requirements are, who's on there, we've been charged to do. I think it's like a 2-pager.
Great, that's perfect. That would be
yeah.
great.
And then that way, but because we do ask that people are able to attend the meetings regularly, and we're not here to like kick anybody off, but also if they don't get officially nominated, there's nothing stopping anyone from coming to these meetings and participating. We welcome all collaboration. The only time that we decipher between members and non-members is when we have to take an official vote on something, and we typically don't do that except for like approving meeting minutes. So we don't really have anything overly formal that would deter somebody from participating.
Great, thank you.
I just had an idea that popped into my head. So I don't know how many of you have heard of the YLF, the Youth Leadership Forum for Students with Disabilities. It's a 4-day leadership training for self-advocates for high school juniors and seniors. They do it over the summer at UConn for 4 days. I was a delegate when I was in high school, and I was a staff for a couple of years. They have a resource fair the last day of the program, like right before graduation. And that might be a good place if we could have a table for the division. We might be able to find some up and coming young self advocates.
Absolutely. Yana, if you can send me that information and I can see what we could put together.
Now, if any of you are teachers and you have high school juniors and seniors who are talented self advocates, I highly encourage you have them apply for next year's session of YLF. This year they're already finished with applications, but for next year, if somebody who's done the program, it's life changing. It's really, and it's a lot of fun too. They have a day where you go do a ropes course, and we have a dance at the end for the kids. And it's a lot of fun, and you also learn self-advocacy, and all of the staff there are self-advocates. All of the counselors in the program are people with disabilities too. So it's an amazing program.
It's great. Thank you for sharing. Yeah, we'd love to get more information on that.
And that's all I had, Gemma, for appointments and updates. So we can move to the next one.
Okay. All right. Let's see, where are we? We've kind of bopped around on this
I'm sorry.
this
Legislative
agenda.
recap
I was
and
gonna say, I think we
priorities.
still have to go back to the legislative recap. Um, and additionally, once we do a roll up, we're also, please keep in mind as you're listening to recap what kind of legislative updates we'd like to identify for 2026. So without further ado, Tara, do you have anything that you were gonna share on screen or just a verbal?
No, I didn't have anything formal. I don't know how closely people followed, but one of our priorities from last year was to increase ABA coverage till 26 through the insurance mandates. And unfortunately, that didn't make it on the consent calendar at the last minute, when they were late into the evening on the last day of session. So we are already working on getting that on the agenda for early in the next session, to continue that. I don't think that it was because there was any major concerns from either party. I think they just ran out of time. So unfortunately um, there was it was a mess. But we're set up and ready to go for the next session. So hopefully we can continue to advocate for that. I know this group would have loved to see no age limit, which is what some of the other states have done. And we can continue absolutely to advocate for that. I know that they put in 26 as to get like a small win, but I'm happy to advocate for no age limit as well. So whatever the group would like to do. So that would be one that we would want to continue for next year. The next one that we were advocating for was a statewide needs assessment. And that is something that Christine Weston and I have been, primarily Christine, but working on trying to find some federal funding for. So nothing major yet, but they did put that into House Bill 7108 that OPM and DSS would attempt to find federal funding to do the statewide needs assessment. So if our current resource doesn't work out, Christine and I will try to continue to find something to push that forward. And this group will be instrumental in getting that work done once something can be identified. So the good news is it's moving forward. We don't have final word yet, but we'll keep that going. And then we also had talked about there was the study that was done on IQ and that expansion. That did not make it into legislation this session, because Medicaid in general right now is so volatile. Like we don't know what's going to happen. I don't know that there's going to be continued conversation around expansion until we have more information on what comes from the federal government. But that did not go through. And then there was a lot that came out for special education. I'm sure everybody saw the increase in funding. And also, there was a bill to look at developing rates for out of district placements. I know that there is a lot of concern from providers regarding setting those special education rates. So that's definitely something that I've heard from several people offline that they would like to continue to keep an eye on and do some advocacy around. There's concerns that there won't be providers. There's concerns that, overall that it's going to impact access for those students who need to access out of district placements. So definitely something that we want to continue to be informed on. CSDE was tasked to do the rate setting in consultation with OPM. I haven't heard personally yet who from OPM will be representing OPM on that. So I don't have any additional information to present, but I know Kim Meerman and Patrick have definitely a better handle on what the potential impact could be. So that's something that they couldn't be here today. They're at a conference, but they wanted me to bring up, as a big flag moving into next session. And there was additional resources provided to OEC. I don't know, is OEC on? I don't know if there's anything you guys wanted to share about the impact for autism, but I know that there was some additional resources provided to them, and also nonprofit funding was, some additional rate increases and resources for nonprofits. So,
yes. Hi, it's Mary Beth.
There's Mary Beth. Hi, how are you?
I suddenly couldn't get any of my buttons and screens to
fast
enough, as is always right, the virtual problem. But so no, I'm sorry. At this time, I don't have an update, but I can try and get one for the next meeting.
Okay, great. Perfect. And that goes for any agency that has, I know it's a little soon after session, so you may not have full impact or, understanding of how, what the impact will be yet, but as you have those updates, we would appreciate them. So that takes us to what priorities we want to tackle then for next year. We have special education and the rate setting, and then insurance coverage. And so those are the two that we know for sure. So it would just be open discussion on if the group has any other priorities they would like to see move forward.
Do we think that the IQ study is worth putting back on the list? Set for evaluating the impact of moving the IQ requirement?
I think that I have a feeling that it's still going to be top of mind for some of the legislators. But we also don't know what we're facing with Medicaid cuts. So I don't know that expansion will be something that, I don't know. I like it's so until we it's almost like a conversation that we can't even really have until we know what's happening at the federal level. It's definitely something that we could continue to assess as we get, additional information.
Yeah, I think we're gonna have to be able to pivot or, put a pin in it until, like you said, we get more information. But when we find out, I would be open to adding that back on. I don't know if Dr. Schlegel, I see you nodding, but I don't know if there's anyone else.
Please, whenever we can bring it back. Yes. So important.
So we already have special ed, we have the rate setting. We'll put an asterisk next to the study for IQ.
Okay.
Requirement. I mean, I don't want to add too much on, and I want to make sure we are focusing on, either low hanging fruit or something that we think will have, enough traction and enough support to get something passed. Hi, Marcia, I see your hand up, but I think you're on mute still. You might have to unmute yourself.
Yeah, this is something that's maybe totally in left field, but I think it's possible to do without a whole lot of expense, which is, one of the things that we are all well aware of is the difficulty for our young adults to make the transition from school to work life. And my experience is that most of the vocational kinds of placements that are considered for kids on the spectrum are fairly, blue collar. I mean, I have a young man who was he was placed in, unloading boxes and, basically digging mulch. And he was taking courses in, business communication and macroeconomics. And so I'm thinking that some kind of thing where during high school or even, even earlier, there might be some kind of program that would introduce students to job opportunity, to kind of the real world kind of opportunities in areas of interest to them. This young guy was not interested in unloading boxes. I had another guy who was a sort of really advanced in science, and he was bagging groceries. And because he had flat affect, the consumers didn't like him, so he failed, and they said he had failed vocational placement. Well, I managed to talk them into placing him in a science lab, and he flourished. So I just think it might help people think about having a future to include that kind of thing much earlier on, even if it's just shadowing for a day.
And do you, Carrie, I see that you have your hand raised. And I'm just going to throw this out here. If you see that as, a policy that needs to be made, or if it's something that we could do through advocacy with like BRS, and our, Kathy couldn't make it on today, but, just throwing that out there to think about as we have this conversation. Sorry,
Well,
go
I
ahead.
think, maybe as we talk about special education, that we bring up the needs of those kids who are doing well in school, but are still on the spectrum. Because, I find that unless you're disruptive, and if you do well in school, you pretty much get ignored. And so but those kids still can fall apart when they have to make the transition, to college or to a real life setting, of work. So I just think it could be part of the ideas we have when we talk about special ed. That's what brought it to mind.
Carrie, go ahead.
Thank
Thank you,
you.
Marcia.
Yeah, no, I concur. I mean, I think we all know, everyone on this call is familiar with the research, right, about the woefully underemployed, if not unemployed, individuals who fall sort of within what I call this gray area of autism, right? Those who don't necessarily draw our attention in the ways that Marcia highlighted, but who are intellectually, academically, otherwise capable, but autism still significantly impairs their ability to gain and maintain employment. And I think it's a both and approach. I think we need to continue to beat the drum with respect to education and repeat those, continue to sort of underscore and highlight and bold text the statistics that we know exist out there, and try to create those inroads and bridges and ramps that we can do, what can be done from in the K-12 system out into the world, although those are difficult constructions. But the both and part is kind of linking to our subcommittee discussions, wherein, I've mentioned, I think we really need to find ways to create whatever we may call them, life coaches, job coaches, partners who assist our individuals not to mask, but to gain the skills that will assist them in gaining that employment and also maybe help to facilitate those inroads. I saw that Christine said, transition, sorry, not transition programs, but partners with businesses and companies and so forth. There are folks in my local high school, an individual, I'll say not multiple, one individual who is helping high school kids, not necessarily kids who are receiving special education services, but helping them to gain employment and employable skills, job skills, for kids who might not be going directly to college or might not ever go to college. They may be learning a trade. Why can't we do similar things like that for our folks? That seems like a really good way by which to better not just their lives, but all of ours.
If I could add some input to the group. So part of what I do as being a parent of a child with autism is I am actually on the Board of Ed of Watertown, Connecticut. And, I have, there's a breadth of things that go on within districts as well. So you can speak to things from quite a few different points of view, right? So I know many districts do have, and are starting to do this. It's like, dual enrollment programs. They're working with different universities so the kids can actually get some credits and, towards college. This really sounds like something that in some way you can piggyback this to work with these individuals, if they're heading out to college and doing things. I mean, this is just gathering the right people in the right place to do the right things, right? It is a very worthy conversation because many of our kiddos and young adults have the skills to do the things right, but they just need the support to do the things. So, we do have a tremendous transition program in Watertown as well. And, I see the kids out and I see them out in the area, but this is, some of our kiddos can do a lot more than bussing tables, right? And I think this is really a very valid opportunity for these young adults to get the skills that they need. And I think this needs to be expanded upon. So if we do anything in this regard, I would really love to be involved. If we as a committee really talk about this and, get a little deeper, it is valid. They just need a little help, a little more help and support in doing the things, and when you have value and you can do things, I mean, it just brings so much more value and self-worth. And I think that's an important for all youth today, not just our autistic individuals. But I'm very excited about even having this discussion. So thanks.
Yeah, I have one young man that is one of my clients who was in a post high school program, till he was 21. And they basically were giving him a kind of one size fits all program that was created for someone who has autism, as if autism wasn't a spectrum. And so he's the one that was taking macroeconomics. The sad thing, speaking to what you were talking about how people see themselves, he told me how bored he was. And and I said, well, say something. And he said, well, nobody's going to listen to me. I'm autistic. And that broke my heart because and there's a thing that I wrote about in a paper where I think it's among the people who are learning disabilities, about 75% of them participate in post-secondary planning. Among the people who have intellectual challenges, about 50% participate. Among kids who are autism, it's about 30. And that's because they don't feel that kind of respect and, value. And so I think this, your point about the impact on the students in terms of how they see themselves is something that dates all the way back. It's not something that suddenly starts when you're 18 or starts when you're 21.
Thank you for raising this. It's not out of left field at all, Marcia. So thank you for that and all the input, Carrie and Christine. Appreciate your viewpoints. As it relates to rolling up to a legislative priority, would it have to, thanks, Lynn, would it roll up to special ed or should it be kind of its own? Tara, you're probably the most well versed on special ed right now. You're on mute.
Yeah, I think that that's where those kids are, so that age, when those decisions are being made for next steps for, after high school. Like, I definitely think that we have to look at, but it's some of these kids, if they're to Marsha's point, if they're, higher functioning in the spectrum, may not be in special ed. Not, not everyone with autism would have a special education or an IEP plan. So, are those some of the kids that are getting, you know, that are then struggling? Because those are, some of those kids that just need, like you guys said, that just a little bit of support, but don't necessarily fall, that are not quote academically challenged, that aren't receiving, special education. So I think that this would be a good conversation to have with SDE. And, I know Brian couldn't be here today, but that's something that we could flag as a conversation that ASDAC would like to have with the Department of Education to see what exists and, how we could advocate for some additional resources. I also think that having that conversation with Kathy from BRS would be an important link too. So using our internal resources, I think that we could set aside some time for this conversation. And Christine, I know you guys have job coaching and stuff within the waiver too, but that's for waiver participants as well. So
Yeah, no, I just wanted to share that. I know we're a smaller subset of this broader conversation, but DSS just, and I wish Kathy was here, we're going to talk about this together. We just launched a new agreement for our case managers and VR to work better together. So we have a new joint MOA. So I don't, state agencies don't always easily talk to each other. There's a lot of rules around that, and you need a lot of agreements to make that happen. And we just executed an MOA with ADS, specifically VR, for our individuals to have a better working relationship there. So we're going to start setting up trainings for our case managers and the VR team to kind of understand our individuals versus how they can support them and how we can do it kind of collaboratively instead of sometimes it almost feels adversarially a relationship. And we're going to really try to improve that, because I think where I heard, a lot of these young adults and older adults are much more than bussing tables, right? It's much more than just saying, can you bag groceries? Where can we go? How did you excel at school? What can we lean into? And it's really thinking outside the box of where they could fit into employment. And I think now that we're trying to build this relationship stronger with VR, our case managers will get that support and hopefully really be able to start having some meaningful placement. I know we're just a subset of it, but it is something we're focusing on. And really trying to, because our waiver really wants to help build that independence, help them sustain themselves in the community, pay their rents, right? Move out of mom's house, all those things. So that's what we're now recommitting to as a best practice in the waiver to make sure we're meeting the employment goals of our individuals. So there's more to come in the coming months with cross training and all that for our staff. So I just wanted to share that.
that's fantastic. I love hearing that. And I think Christine too, like if there's, things that you guys discover and create those connections and resources that could extend beyond, just your case managers to other staff within BRS that maybe, that's now they have a better understanding as a whole for other people that they may engage with outside of just waiver participants. So thank you for that. And I would love to continue to get updates on that. So
I have a quick comment. I can't figure out how to put my hand up on here.
you're good. Go ahead.
I'm kind of new. This is my first time in the group, and my son is falls into that category. He's pretty high functioning. We are actually fortunate. We are still with the school district. This is his last year, but we are doing a transition program at Post University, and I believe there's one down in Western Connecticut State University. This kind of fell upon my lap, this program for him. I had a neighbor whose son went through it, but through the district, like they weren't, it wasn't part of what he could do. So we might have missed out. So this kind of ties into also what Christina's saying while he's there, like connecting with internships, more about what he's is majoring in, or so I don't know. I just felt like I needed to comment on this part of it, that there's a subset of kids like my son that are trying to figure out where we fit into this whole waiver process and what can we do to help them also in terms of increasing independence. And I love the housing. We're talking about housing because he will be he will be an adult who can live independently, work, maintain a career. But I don't see where we fit into all of this. So I just wanted to make that comment. Thank you.
Thank
Thank you.
you.
We always welcome your participation. So thank you for that. I had a question, Tara, for you. When we think about these legislative priorities for 2026, are we suggesting to augment rate setting, special ed stuff, or we're just wanting to keep that as our priority? We're not really suggesting changing any our stance on anything or adding anything new. Is that correct? Or like, I guess I just want to frame that for this group, because if we're at, like in the study for the IQ requirement, we would want to keep that status quo and just continue advocating for specific language for those existing priorities. I want to just
IQ's tough because if that there's part of the reason it didn't go through is because we need additional information. There needs to be some, and that's what basically the study results were, that in order to understand the impact to the system, we need to do some predictive analysis on how many kids are we talking about coming into the system who would be qualify for those services. There's also, I think, a huge misunderstanding and targeting of DDS services, but it would impact the adult, or, not just adult, but the lifespan autism waiver in Connecticut as well. So that's like 5 waivers that would need to be rewritten and resubmitted to CMS. And I mean, this is a large scale system change that you would be advocating for. Part of the reason it didn't make it through this year was because we needed those additional appropriations in order to study the impact to the state. What we did not want to see it was, and this isn't Tara, this is just the reality of what would happen, is that if we made these promises to families and said, okay, we're going to eliminate IQ, but there's no additional appropriations made, there is no more access, there isn't increased access. We're not expanding the waiver access. We're just creating really big wait lists in the state. So there's also, we really need to look at the appropriateness of services and what services and what agency would be more appropriate for that subset of individuals. So it is, so basically, from my research, we would need approximately another $400,000 over the next, so $400,000 to do the next round of study, because we have to get experts that can come in to do that predictive analysis. And that would be, if so, we already passed the budget for the next 2 years. So the reality of getting that into the next legislative session would be a challenge, because they're not, although they can do some budget adjustments, I don't know that we're going to get the level of funding that we need in order to do the assessment that needs to be done to move that forward. That
makes sense.
In addition to that, we don't know what's happening at the federal level and what cuts we're going to have to deal with. So if we have to ramp up funding in the state for other things to maintain current services because of the cuts that are happening at the federal level, that's what I was talking about, expansion. That would be considered an expansion of services. So I think that if you're going to advocate for that, you need to have a very specific ask of what you're looking for as a way to move that conversation forward. Is it advocating for the appropriations to do the additional study? Is it advocating for additional information? So I think that you would need to be specific about what you're looking
Okay.
to what your ask is, as we move forward. And again, that's why I was saying it's going to be very heavily dependent on what happens at the federal level. Just
Thank you for providing all that context. Because, we have 20 minutes left. I do want to try and get some buy-in here from our stakeholders on the council, as to, are we all in agreement for the legislative priorities that we've been discussing? And certainly, Marcia's topic that she introduced. So
And
Tara, can you
we
go
continue
ahead?
to flush this out. I mean,
Yeah.
they don't go into session until February. We just wanted to start this conversation, so that we're prepared for the next, that we're preparing of what our priorities are. So,
And how many more meetings do we have this year? 2 or 3?
yeah, we meet again in September is our next meeting. So, that would be, and then we meet in October. Is it October or November? November.
I thought it was
So
November.
September
Yeah.
and then November. Mhm.
So we'd
So
want
we
to
have
have it all
time.
locked down, but we'd want to
Mhm.
have it locked down going
Yeah.
into, okay. Okay. Well, no, I think that this has been a great discussion.
And Kim was hoping to, I think that for the legislative pieces, that's something, we can set up that meeting cadence once I get that with Kim, we can send that out to the group to set that up so that we can continue those conversations. And that way that subcommittee can meet more frequently for those who are interested in continuing these conversations.
Excellent. Okay. Any other comments on legislative updates as we move through our agenda? Okay, do we have any other agency updates? Tara, is that where we're at next? Just check me.
Yeah, I didn't get any
Okay.
from anybody. I don't know if anybody's on. If they have any, they're welcome to speak up, but
Hi, excuse me, this is Ann Janet at DPH. I just wanted to let folks know I did resend the information that was chatted about today, and also want to offer, if we do think we're going to have a meeting date around workforce development, I'm happy to participate, but also I think the folks who are doing the actual workforce development at DPH would also be a good group to invite, because they are in the deep dive of that. So whatever date we decide for a meeting, maybe enough, some notification so we can get that broader input. And I think we're going to have to, work on doing some connecting of the dots too. And I think that's why I even reinterpreted the email a different way when it was sent again, because I do think that, like we do in a lot of work we do, we got to kind of bridge the difference between services that are available and how we can make them work for the people that we are helping and supporting in the community. So how to make it all work together. So I just wanted to share that update and that additional information.
thank you, Anne. Appreciate that.
Can I ask one more question? Sorry, I still
Mhm.
haven't found my hand up sign. Just to go back, I missed, there's open spaces for this council, and one was for a person who was affected by autism. And was there another space or just that space?
There will be one of our members is retiring. She is works at the hospital for special care.
Okay.
And so that specific position is open for a service provider to people with autism. And then and it's an adult and then the service provider.
Okay, thank you. I
Yep.
missed that first part. Thank the service part. Thank you.
And that's all I have.
Yeah, I don't think we have any, I don't see any other agency updates coming in. So it looks like, yeah, our next two meetings will be September and then November. Okay. We will have to start putting together our 2026 calendar. We've already talked about a March in-person meeting. We know February starts the next session. Is that accurate, Tara? Okay. So those are just some parting notes I wanted to leave you all with. I don't have anything else for the remainder of the agenda, so I'll leave it open if any members or anyone on the call has any other updates. I'll just leave it open for a moment. It's been a long meeting. Thank you all for for hanging on so long. Okay, I don't hear anyone. I'm going to get ready to adjourn. I just want to thank you all. This has been a great discussion. It's so nice to see your faces. I hope everyone has a great summer. Enjoy your time off. And again, thank you for all your hard work and participation over this legislative session. It was fast and furious. It's really wild, but I think we've got some great momentum. So I just wanted to thank you all for your hard work and enjoy the rest of your week. Thanks, everyone.
Have a
Bye-bye.
good day, everyone.
you.
Yes.
You too.
Bye.
Bye-bye.